Emotional intensifiers, we talked about it a little. Guilt, invariably, the people that I see in my practice feel like they deserve their pain. And the extreme is a guy who was a firefighter. He watched a car go over a bridge. He was able to save the mom. 16-month-old baby died in the car. 6 months later, he injured his back. He was on opioids for the next 20 years. Intervened, came to treatment. We took him off his opioids, and within a week, he had intrusive nightmares about that PTSD experience that he had watching that baby die. And he felt like the pain was God's punishment for his inability to save that young child. And he had a lot of work to do to unveil the truth. The Buddhists say pain is not a punishment, joy is not a reward, they're simply occurrences. Anger and resentment, anybody deal with work comp? They're the toughest. And anger drives that pain. And sometimes it's justified anger, but it doesn't matter whether it's justified or not. Anger drives the system to exacerbate pain, and resentment even worse. Loneliness. This is a very isolating illness. That identification with pain separates people from others. They feel very helpless. They do not feel like there's any solution. And lastly, they have a lot of fear, and usually the fear is that I'm going to get worse. I'm going to end up in a wheelchair. That's the fear that's most commonly expressed from the folks that I treat. Fear drives avoidant behavior. It's called fear avoidance syndrome. It hurts when I do this, the old joke, Henny Youngman, doctor, it hurts when I do this, don't do this. Well, if you don't do this long enough, then you can't do this. You have decreased mobility. If you can't do this, I can't put my jacket on without assistance, and then I feel really bad about myself, and then I don't want to go anywhere, and then I'm more isolated and I feel more helpless. Just try to remain calm, Art. They can sense fear.